A migraine is not just a bad headache. If you ever really had a migraine, you know exactly what I mean. If you have ever real migraine, you know disabling it can be. The throbbing pain, nausea, and sensitivity to the light, dizziness, visual changes, neck tensions, and the feeling that your entire nervous system has been overloaded and can destroy your entire day, and sometimes even several days. And many people think migraine is only pain problem, but migraine is much more than a pain. It is a neurological event, and very often it is a sign that your nervous system has too sensitive or being too reactive and too easily triggered. And a lot of you never realize what exactly is the real causes of your migraine. And in today's video, I'm going to explain you why mind perfect or one of the most serious reasons why you have the migraine is going to be mineral deficiency. The hidden triggers behind migraines: stress can trigger the migraine, hormonal changes can trigger it, poor sleep, bright lights, weather changes, certain foods, low blood sugar, constipation, allergies, neck tension, and even dental problems can all play a role. But underneath many of those triggers, there are many of one very important mineral imbalance that is often overlooked. And today I want to explain everything that you need to know, especially about magnesium and the calcium. And those two minerals play a crucial role how you can prevent migraines in the future. And this is one of the easiest solutions for everyone who suffers from the migraines. Magnesium and calcium are very important for the nerve balance, and calcium is an activation mineral, and magnesium is the relaxation mineral. Calcium helps nerves fire, while magnesium helps nerves calm down. And calcium helps muscle contract, while magnesium helps muscle relax. And calcium is like go signal, and magnesium is like the slow down, calm down signal. And when magnesium is too low, or when calcium is too dominant, the nervous system may become excitable. This means your nerves may react too strongly to things that would not normally be dangerous: a bright light, a stressful morning, a skipped meal, or a poor night of sleep, a hormonal shift, or a change to the weather. And this is so crucially important to understand. For the last 26 years, when I work with the patients who had those migraines, in many of my patients I can see clearly that something is really wrong with mineral or vitamin disbalance. What actually happens when you have the migraine? For many years, migraines were explained mainly as a blood vessels problem, and the idea was the blood vessels in the brain would constrict and then dilate, creating throbbing pain. But today we know that migraine is much more complex. It involves the nervous system, the trigeminal nerve, inflammatory signaling, blood vessels changes, hormones, and the brain sensitivity. And one of the important nerves involved in the migraine is trigeminal nerve. This nerve sends signal from the brain to the head and the face, and when it becomes irritated, it can trigger the pain signals and inflammatory substances around the tissue that's surrounding the brain. And this is one of the reasons why migraine pain can feel so deep, intense, and disability. It is not simply pain in the head, it is entire nervous system reacting. And one of the main reasons why those nerves in your brain, especially in your face, are overreacted is going to be those disbalances with calcium and magnesium. And today we must really, I will try to explain exactly the perfect supplements and exactly perfect doses that you can help yourself in the safe and natural way. Why magnesium will help with migraine? This is where magnesium becomes so important. Magnesium helps calm nerve excitability. It supports muscle relaxation, blood vessels function, and normal energy production. And more balanced nervous system response. When magnesium is low, the body may become more tense, more reactive, and more vulnerable to the spasms, cramps, anxiety, poor sleep, and the headaches. Many migraine sufferers also have thigh neck muscles, jaw tension, poor sleep, restless leg, stress overload, or a muscle cramp. Those are all cues that the nervous system and the muscles need better mineral support. And why magnesium is so important? Of course, one of the crucial way why you can help yourself in the safe and natural way is going to find perfect daily dose, especially magnesium, of course, and the calcium, for removing those symptoms and even preventing something called migraine. This is what you really need to know. Best magnesium forms from the migraines. The form of magnesium matters. Magnesium oxide is common and inexpensive, but many people do not tolerate it well, and it may cause loose stools or stomach discomfort. Magnesium citrate is often better absorbed than oxide, but it can also have mild laxative effect. So it is not ideal for everyone. For migraine support, sleep, muscle relaxation, and nervous system calming, magnesium glycinate or magnesium bisglycinate is one of the best choices. It is usually gentle on the stomach and very well tolerated. So my recommendation for you is going to be use regularly if you have headaches, migraines, especially something magnesium glycinate or bisglycinate. Usually during the day, but especially 1 hour before the sleep is going to help you a lot with your nervous system, all those tensions in your headache, in the safe and natural way. Practical dose and the safety. Many adults use around 200 to 300 milligrams of magnesium per day from the supplements, often in the evening, because magnesium may support relaxation and the sleep. But this is very important. Do not take high doses of magnesium without professional guidance. Higher dose may cause diarrhea, low blood pressure, weakness, or interactions with medication. And if you have kidney disease, heart rhythm problems, low blood pressure, or if you take heart medication, blood pressure medication, diuretics, antibiotics, or other prescription drugs, speak with your doctor or qualified healthcare professional before using magnesium supplement. This is perfect to understand. My recommendation for those migraines is going to be, of course, use magnesium and, of course, calcium. Magnesium probably 300, 200, 400 milligrams daily, and calcium minimum about 1000 milligrams daily. And for the last part of the video, I'm going to give you perfect food solution for your migraines. Try remember this. Food should always be the foundation. Some of the best magnesium-rich food includes pumpkin seed, almonds, cashew, black beans, cooked spinach, avocado, brown rice, whole grain bread, yogurt, salmon, soy milk, peanut butter, and the milk. A simply daily plan could be very practical. In the morning, you can add pumpkin seed to your almonds. During lunch or dinner, include cooked spinach, black beans, brown rice, or avocado. Or in the evening, if needed, and if safe for you, magnesium glycinate or bisglycinate may support relaxation and sleep. And this is my recommendation for you, that my dear one. If you didn't already, subscribe to my channel. For the last 7 years, I was making, and I regularly making. Right now, maybe on my MarioLab YouTube channel, you have almost 5,000 to 6,000 videos about nutrition and natural remedies. You can search my channel. You can call my office for my support and help. And if you want to learn a lot more about nutrition and natural remedies, below the video, you have the link to my 4 books about nutrition and natural remedies. And of course, if you like this video, try share it, because a lot of you don't even realize that magnesium and calcium are so crucial for removing migraine. For a lot more information about the best natural vitamins that really can help you protect your brain in a safe and natural way, watch my video right here. Thank you for following me. See you next time. Bye bye.